Well, Americans as young as 30 worry about the possible aging problems they could face as they get older. According to the West Health Institute, a survey with NORC on aging on America, developing memory problems, facing health and financial issues, and losing their independence are some of the top concerns. 70% of Americans also think the country is a little or not at all ready to address the health care needs of seniors.
And here to talk more about the study is Dr. Zia Agha, Chief Medical Officer of the West Health Foundation. Thanks for being with us tonight. Sandra mentioned some of the biggest concerns. What would you say, based on the analysis of what you looked at and the data, what's the number one concern?
I think you touched on one of what we would consider the top concern, that 70% of all adults in this country responded that we were not prepared to take care of our senior population. And we know that our senior population is growing. 10,000 baby boomers are turning 65 nationally, and in the state of California, 1,000 baby boomers are turning 65. We know that by 2030, that population is going to double. Just in our county in San Diego, there are around 375,000 seniors right now, and that's going to be 700 plus in a short time of 15 years. I think the other thing we asked around the direction is the country headed in the right direction. And around 60% felt we were not headed in the right direction in terms of the services we were prepared to provide, whether it's healthcare and social services and supports.
Do you think the negativity has a lot to do with younger people watching as their parents and grandparents get older and seeing some of their struggles within the healthcare system and society as an older American?
I think you touch upon something that's really important. When we asked the younger generations about these concerns, they were actually more magnified than the older generation.
More pessimistic.
More pessimistic, definitely more pessimistic. And that's been borne out by other sort of research studies that have shown that as you get old, you develop certain resilience or certain ability to appreciate life in a different light. It's not just about not having a health problem, but it's about other things like relationships that matter to older people. I think there's also a difference between the expectations for younger generation and what they want out of there, and it's definitely higher. We know that.
So if you were itemized, say, go down the list of things that need to happen to improve health care, to improve senior relations and that sort of thing from the standpoint of health services, social services, what would you list? How would you list those? What do we need to be focused on?
So I think it's very clear from our survey respondents that it's not only, I mean, healthcare is clearly the number one thing that they care about, yeah. And that is important, and we do a lot around healthcare in this country. But it was very clear that other things, like having the social services, having in-home care, having access to healthy nutrition, having access to transportation that is age-friendly.
And I read in your report, too, that also doctors, in-home doctor visits, and doctors making house calls now, which is something, you know, they're kind of starting to do, but it's pretty pricey outside of the insurance, your insurance policy.
Yes, that was when we asked people how would they like to access care. Both the younger and the older group responded favorably for ways of delivering care at home, whether it's through house calls, which is the doctors making home visits, or using technology like telehealth, or even getting their medications delivered to their home. And we're seeing this shift happen in this country where, you know, healthcare used to be in the four walls of the hospital. It shifted out into the clinic, ambulatory setting, and now it's shifting into the home. And I think the responses are in line with that. On the other hand, we do see that currently, today, very few people, like you said, have access to these in-home services. Less than 1% approximately of Medicare-eligible seniors access telehealth.
And that's because it's pretty expensive.
It is not fully reimbursed. It's pretty expensive to set up. And I think as we are sort of moving towards more of a population health platform, we will see more of it.
It's a very interesting study, and we'll have more of it on the KUSI website. Dr. Zia Agha, thank you very much for coming in. Appreciate your time.
Thank you.